dear students. So as a continuation of activity and exercise which you have been seeing yesterday, we will be watching few more procedures which are under the same topic. Okay, and I will be discussing first about something called dangling. It will be written in your book as dangling. So it is ambulating a patient. Ambulating means just moving the patient who is very weak or who had surgery just yesterday or something to a chair, or making them to walk even around the ward. Okay, it is according to the nature of the surgery, or it may be first day, second day, third day, it will be a different procedure. This patient, why he is very weak, he or she is weak because before surgery almost 8 to 12 hours of fasting. The day of surgery also patient cannot take anything, only IV fluids are going, and the next day you are going to transfer the patient from bed to the chair. So you have to keep these things in your mind. Okay, and also another important things, okay, the assessments are same, whether patient had any pain medication, whether patient had any the surgery, how big it is, or whether you need support of another person according to the weight of the person, all which we have seen in positioning, lifting and all that, same assessments to be done. Okay, after you do those assessments, you can come to the patient. Okay, it is better to check vital signs now, or you take from the record if it has been done just now. Okay, so vital signs are important. Then after I reach, okay, hand washing, then introducing, checking the identity and explaining the procedure, providing privacy, all these becomes mandatory. Okay, I am not going to those steps. So what is the first step I am going to do? Miss Cherry, I will be moving you out of the bed. I hope your pain is okay now, because I see that they have given you pain medication. Okay, we'll be, you try your level best, how much ever we can do, we'll do that. Okay, so first of all, you lower down the bed the patient as much as possible, because it will help the patient to reach the floor very easily. Okay, what will be the next step? You will be helping the patient to turn towards you. Okay, so okay. Can you keep your hands here and then just turn to one side. Okay, make the patient to turn to one side. Turn to one side, and you should be careful, they should not fall down also. Anyway, we have side raise. Later I will tell you at one step you have to be careful. Now you raise the head end of the patient so that you are bringing them almost to the level of sitting position. Okay, all the position changes we are going to do it step by step in this patient. So what was the first step? Lowering down the bed, then making the head end higher, making the patient to turn to the lateral position. Okay, now you slowly put the side rails down. Okay, after putting the side rails down, you have to be careful, this patient should not fall down. And remember, as I said, we have changed now halfway the position. Now we are going to make her sit in 90 degree. As we keep changing position, we should remember whether she has something called orthostatic hypotension, because as we change positions, the patient's BP can lower down and she may feel dizzy. So we have to be careful about that. Miss Cherry, are you okay?
Yes.
Now what is this step? I have to put my hands underneath her shoulders. Okay, I am going to do that, and then I can move her legs towards the edge of the cot. You see both the legs towards the edge of the cot. My one hand here and my other hand here. Okay, it is a little tough one, but what am I depending on? My patient also can push her hand and she can also lift along with me. You understand what I am saying? Okay, see how I am going to do that? I have to do pivoting. Okay, I need to put my hands under her shoulders, I need to put my hands under her legs. Same time I am going to make her sit and put her legs down. You see my legs, it should, when I am standing like this, it should pivot like this. So I bring her like this and make her sit. Okay, and that's why I said we should know the weight of the person, whether we will be able to do by ourselves or do we need the help of another person. Okay, I think I will be able to manage Miss Cherry, because she is also conscious. She can also help me in getting up. Okay, Miss Cherry, at the count of 1, 2, 3, you are also pushing and your legs are down, and you will be sitting on the bed. Is that okay? Okay. One. Okay. Are you okay, Miss Cherry?
Yes.
Okay. No dizziness?
No.
Okay. If at all you have not checked the vital signs, you can even make them sit like this. At this stage also you can check. Especially we want to see the blood pressure and the pulse rate. Okay, if she is okay, ask her to put her hands like this, move little in front and come, and ask her to dangle the legs. What is the meaning of dangling? Just moving the legs very well so that we are promoting venous circulation, or we are promoting circulation to the head end of the patient. Are you clear? Okay. Now, what will be the next step? From this step, I want to take you to the wheelchair. Imagine now she has to go to some unit in the hospital. There is an X-ray for you which has to be taken. So we'll take you in the wheelchair. We'll go there and come back if you are all right. Okay. So she's fine. Okay, I'm bringing a wheelchair for her. Okay, this is called wheelchair. Okay, it looks like that. There is a place where she can sit. There is a place where she can rest her hands. Okay, there is a handle for us to handle it. You will see two wheels. Okay, there is a rim also. The metal rim is for the patient to handle by themselves when they are sitting on it. Okay, and you will find, see, these are the locks. Before the patient is getting on, you have to put the locks. Both sides we have the lock, and there is a footrest where the patient can put their legs. Okay, when I want to shift the patient to wheelchair, see how do I place my wheelchair? Keep it parallel to the bed. Okay, keep it parallel to the bed, and then leave the footrest up. Then only the patient can come and sit. What else I should remember? Put the lock for the wheel so that it does not move till my patient is sitting. Okay, now how she is going to get up and come and sit with me? Okay, she has to follow something called mirror. See, when I see myself in the mirror, which leg? See, my left leg should be her right leg. My right leg should be her left leg. Let me support like that. Okay, before that I ask her, which leg is stronger? Your left leg is stronger, so can you put it back? Whatever is there, stronger leg, let it be backward. The other leg which is not very strong, they feel like that, okay, that should be forward. So that, okay, and you see how I am supporting her. You keep it on the side till she is getting up. In case, see, she said she's fine, she's okay. In case when she's getting up, she's feeling like dizzy, she's about to fall, you can support with your legs and put her back down. That is the reason we are supporting like that. Okay, now what we both are going to do, as I walk behind, she will walk forward, then we move till the wheelchair and we are going to put her back. Okay, put her in the wheelchair. Okay, Miss Cherry, now we'll be getting up, but you hold my okay, you hold me here. Yeah, you can hold me here. Okay, if you have at this stage, if you have a belt, okay, we don't have belt in the hospital setting, but we have it here. When you come to the lab, we will show you how does the belt look. You can put the belt over here and you can hold with the belt. If not, okay, don't put your hands under the this area. Okay, you are not supposed to hold axillary region because a lot of nerves are here. We can injure sometimes, so we are asked to hold only this region. Okay, see my legs, see my hands. Miss Cherry, with the count of 1, 2, 3, we are going to get up. Okay, see my legs, how I am supporting her. Down, my legs are crossed so that I support her. Okay, and I'm going to lift her with this. 1, 2, 3. Okay, are you okay?
Yes.
Shall we move? Can you bring your left leg? Yes. Can you bring your right leg? Okay, left leg. Okay, right. Okay. Can you turn? Okay. Then rest. Yeah. Okay, so mirror her legs and come till the wheelchair. Now ask her to push with her hand and go behind. Yes. The patient himself or herself can move and go. Okay, now you may have question. This patient is conscious patient. So what if the patient cannot do? What if the patient, because I have heard from many students asking these questions. If the patient cannot cooperate with you, we never shift the patient in wheelchair. Okay, such patients will be shifted only in the stretcher, which we will be seeing next. Okay, after you make the patient sit, put the footrest for them. Okay, they can put their legs over there. Then you have to remove the locks. Okay, and you see if the patient needs some covering. Okay, you can put some sheets to cover the patient, because we are taking them to some other unit in the hospital. So just cover the patient with the sheet neatly. And then her shoe should be given. Okay, when she was getting down and standing itself, we can give the shoe, because now it is difficult for her to put it on. Okay, so when I make the patient stand up, I can give the shoe, or when she is sitting and dangling also, I can make her put her shoes. Okay, so put all these things safely, and then you will be transferring to the area wherever you want. Now there is one more caution when you are taking the patient. There are some areas which are ramp in the hospital. I do not know what you say for ramp in Arabic. Instead of staircase, steps, they see sometimes slopes are there, right? So when you are going in that area, you should be very careful. You don't push like this forward and go. You have to totally turn. Okay, you first come, then the wheelchair should come. It should be like that. Okay, I'll repeat it again. When we are going in slope, up it's okay. When you are coming down from the slopey area which is very high, and you are coming down in the sliding area, you should be the first one to move, then the wheelchair along with you, so that the patient will not topple and fall. Another point, never allow the patient to stand on the footrest and get down. The wheelchair will topple down. Okay, see, these are the two safety things you should remember. There are some wheelchairs which has belt over here. We can put it maybe for children, that may be useful. Okay, those things and all you should remember. Okay, after you finish your procedure, come back, same way, make it, stop it parallel to the bed, put the locks. Okay, then remove those footrests. Remember, you should remove. Then ask her to hold it and come forward first. Okay. Then the same way we are going to mirror walk. Mirror walk, and okay, can you go behind? Okay, can you sit? Then ask her to move nicely inside. Then we are going to put her in lateral position. Whatever position you want to put her, she will be back. Okay. Is it clear? Any other points? Okay, if you have any doubts, your teachers will have some discussion with you. You can clarify it with them. Okay.